Acute Stress Disorder by Larissa Myron.
What is acute stress disorder, or ASD?
Acute stress disorder is a type of anxiety disorder. After a type of tragic event
Such as a death in the family is when you may develop ASD. It will develop about a month after the event and will last about 3 days, but could be persistent up to a month.
What causes ASD? Witnessing, experiencing, or being confronted with one or more
Tragic events can cause ASD. The reason for this is because these type of events can make someone scared or feel helpless. Some events that could make someone develop ASD is death, threat of death to oneself, or threat of serious injury to oneself.
Symptoms of ASD. A person will have 3 or more of dissociative symptoms for them to be diagnosed with ASD. These symptoms include feeling numb,
A reduced awareness of your surroundings, depersonalization, when your thoughts or emotions does not seem real to you,
dissociative amnesia,
when you cannot remember one or more important parts of the tragic event, having trouble sleeping, or being startled very easily. These symptoms of ASD may cause a person to stress and not be able to function at work or in their social life. It is very important for us to watch our family or friends closely after they have experienced some sort of a traumatic event.
Who is at risk for ASD? While anyone can develop ASD, some others
might have an increased chance of being diagnosed if they have a history of ASD or PTSD, a history of certain types of mental disorders, a history of dissociative symptoms during tragic events.
Statistics of ASD.
According to the U.S. Department of Veteran Affairs, about 6 to 33% who experience a traumatic event will develop ASD. This rate truly varies on the tragic experience they had went through.
How is ASD diagnosed?
Your primary doctor or mental health care provider will diagnose ASD by asking you questions about the traumatic event and your symptoms. It's also important to rule out other causes such as side effects of medication, drug abuse, or other psychiatric disorders.
How is ASD treated?
The treatment of ASD will depend on what your doctor thinks is best, but there are a few options such as cognitive behavioral therapy, psychological debriefing, or psychotropic medications. The one option that many doctors will suggest first for ASD is cognitive behavioral therapy, since it is so successful. It aims to change the thoughts and feelings surrounding the tragic event, which is very helpful to those diagnosed.